In this video, I'm going to give you an overview of salivary testing and specifically the Bristle test, how it works, what's included in your report, and how you can use it in your patient care. So let's get started. So let's start with why salivary testing even matters. The oral microbiome, which is the community of over 800 species of bacteria, fungi, and viruses living in our mouth, plays a major role in both our oral and overall health. And just like diet or our hygiene, it's a key factor that can tip the balance towards health or disease. With a quick and easy sample of just saliva, we can test the microbiome and we can see what microbes are present and at what levels. Now, this information gives you as a clinician a deeper understanding of disease severity and the risk of progression beyond what's visible clinically. And you can use this data alongside your clinical assessment to optimize your treatment plan and ultimately get your patients healthier. The Bristle test analyzes the entire oral microbiome, so all 800 plus bacterial and fungal species just with a single test. That means we evaluate both the beneficial and the harmful microbes to give you a comprehensive view of your patient's health and truly determine if their microbiome is in a state of balance or is in a state of dysbiosis. In the test results, there are insights for tooth decay, gum inflammation, bad breath, gut health, and much more. And with this information, you can ultimately personalize and optimize your patient care. Each report starts with 7 core insights, which are calculated based on all the species detected in the patient's saliva. Most patients have between 70 to 150 unique species of bacteria and fungi in their mouth. Based on the levels of these species, we distill down to simple 0 out of 10 scores for tooth decay, gum inflammation, beneficial bacterial levels, halitosis, gut impact, nitric oxide, and microbiome diversity. This gives you a snapshot of your patient's health, what the issues are, and where to focus as far as treatment. For each score or condition, you can drill deeper to see all the microbes that impact that condition, and if they were detected in the patient's sample, what the levels are. You'll also receive a full breakdown of all of the species that were detected. Additionally, we provide associations between bacteria detected in a patient's mouth and systemic health conditions that they're associated with. You can use this to help educate your patients on what pathogens are present and the impact their oral health can be having on their overall health. Based on the results, we provide guidance to you for in-office and adjunct therapies that you can consider. You can pair these test results and our guidance with your own clinical assessment to optimize your treatment plan. And we also provide home care and lifestyle guidance based on test results. Going beyond just brushing and flossing, this includes specific oral care ingredients that can be helpful based on results, supplements, as well as dietary recommendations. Importantly, you have full flexibility in customizing the patient's care plan. So within the report that you share with your patients, you can actually tailor the treatment plan by incorporating your preferred products, therapies, and clinical judgment. And you can also save down templates. So let's say you have a standard protocol your office uses for all high caries risk patients or gingivitis patients. You can save those down as a template and then easily apply it to any new patient reports, making the entire process much quicker and easier. Ultimately, our goal here with testing is to improve patient health, and retesting is a powerful way to track patient progress. Start with a baseline test, implement a care plan, and retest to see how scores shift. It's a great way to measure effectiveness, fine-tune interventions, and keep patients engaged with their care by allowing them to visibly see what works. There are a number of ways that clinicians are using the Bristle test, but I want to share a few of the primary use cases. So first is establishing a baseline as part of new patient exams to understand the root cause and risk for different conditions beyond what's visible clinically, and also see how their oral microbiome can be impacting their overall health. Number 2 is periodontal patients. Testing can help determine the severity of disease and likelihood of progression so you can tailor your care plan accordingly. Retesting post-perio treatment can also help monitor efficacy. Clinically, the patient may have improved and look healthier, but their risk based on the microbiome could still be high, which would warrant additional treatment. Number 3 is patients with any systemic diseases or conditions like diabetes or cardiovascular disease. These are all at-risk patients. And given the oral systemic connections that exist, it's important to test them and make sure we're managing not only their oral health, but also their overall health. Although salivary testing has existed for decades, there are a number of technology advancements that have changed what we're now capable of analyzing with saliva tests and the value they can provide. So I wanted to take a moment to explain what differentiates Bristle and why it matters to you and your patients. So the first key advantage of Bristle is that we detect all bacterial and fungal species, not just a handful of 10 or 20 of the harmful pathogens. When we think about true health and a healthy oral microbiome, it's not about just wiping out the harmful bacteria. It's about creating balance between the good ones and the bad ones. With Bristle, you get a picture of that full community and the levels of dysbiosis, all with a single test. The second is providing insights into multiple oral health conditions like caries, periodontal disease, and halitosis, not just a select list of pathogenic microbes. Third, Bristle provides insights beyond oral health. How is a patient's oral microbiome impacting their gut health or their ability to produce nitric oxide, which is important for cognitive and cardiovascular health? These systemic insights allow you to practice whole body healthcare. And fourth, patient-friendly results. Instead of just a chart of bacterial species and numbers that a patient can't understand, we provide easy-to-interpret scores so patients can understand what's actually going on in their mouth. This helps motivate, educate, and engage patients to take care of their oral health. Testing is ultimately a win-win-win for patients, clinicians, and practices. For patients, salivary testing is just like getting blood work done by your primary care physician. It helps improve outcomes and helps patients better understand what's going on with their oral health and the root cause of their conditions. For clinicians, it helps you increase patient engagement and compliance, enables you to practice oral systemic care, and optimize your treatment planning. And at the practice level, it builds loyalty and trust by giving patients third-party lab testing and quantifiable data, and it can increase ROI by attracting new patients and more case acceptance. The actual testing process is actually quite straightforward and very easy to incorporate into your existing workflow. So you collect a milliliter of saliva in office, which takes just about a minute from the patient. Each tube has a preservative to stabilize the sample while in transit, so no refrigeration required. Then you register the sample to the patient in your online Bristle account, mail the sample back to the lab with a prepaid return envelope that comes in each test kit. And then in 2 weeks, you get the test results online. You're able to customize the care plan and then share the report very easily with your patient, either online or print it out for in-person sharing. As far as pricing, the test retails for $169 online to the public. And for healthcare professionals, we have discounted pricing, which is between $100 to $120 per test, and that's based on monthly volume. It is a pay-as-you-go model, so you only pay $15 up front for each test kit, and then the remaining lab cost is billed at the end of each month only for the number of tests you send in that month for processing. So if it's 5 in the month, you're billed for 5, and if you don't send any, there's no charge. As far as supporting you as you get started, we provide training and onboarding up front to make sure you and your team are comfortable using the test. And once you start getting patient results, you can schedule calls anytime with our clinical coaches to review the results, get help with interpretation and care planning, and make sure all your questions are answered. We know incorporating any new technology or product can feel daunting, but our team is here to make it easy, and support you every step of the way. We're excited to work together, and let's get started.